for your comments. Many know that Speaker Ryan put forward a plan this past week, and so to talk about that, we should probably put out there what the Speaker put out, which is some of the ideas you discussed. Instead of an individual mandate and subsidies based upon income, it would give a tax break to anybody regardless of income. But there's no numbers on the plan, and there's no details on the plan. And so to know whether or not it's going to help people based upon need. Yeah, I'm going to go through the plan since the Ryan plan was brought up, and we should discuss it briefly since it is one of the plans that the major plan that we're seeing as the quote-unquote alternative. There's no numbers or no plan details on the proposal so far. So the amount of the credit or the type of plan, whether it's major medical or a fully covered plan, which you were talking about, is not certain. If the tax credit falls short, then there'll be less coverage. If it's more robust, then I guess we'll see. But we don't know yet because there's no numbers. Also, older Americans will be harmed if they don't receive higher tax credits because generally our seniors who aren't, or excuse me, older Americans who aren't eligible for Medicare yet use more health care because there's more conditions, obviously, as we get older. There's a use of health savings accounts, which already exist. Those with disposable income are usually able to use these, but working families that don't have any money don't have the money to put forward into a health savings account. So it would potentially allow insurance companies to sell across state lines, increasing competition. And I guess the other side is that we potentially have the federal government now policing 50 states of health insurance, which I know people are already concerned about what we monitor on the federal level versus the state level. So that's kind of it on that. And then instead of protecting everyone based upon pre-existing conditions, the Ryan plan would give states grants to create high-risk pools. So those with pre-existing conditions would be in their own pool. They wouldn't be put on the same level as everybody else. I'm just saying the plan. I want everybody to know both plans that have been out there to the extent, because I want to make sure everybody is understood about it. It would phase out Medicaid expansion and stop Florida from having the opportunity to expand Medicaid. So that would no longer be an option for us. And it would block grant Medicaid, either that or per capita. And so it would go from defined benefits, which is Medicaid would cover these types of procedures and issues, to defined contribution where the states would be granted a chunk of money and said, here's all you're getting, regardless of the need, and then you be creative about it. Now it depends on how big they are, the block grants, whether they're going to be successful, but a lot of us are concerned that this is a way to cut Medicaid in a fancy way. And so we'll be looking at that with some concern, but I appreciate you bringing that up because the Ryan plan was just released. The only problem is no numbers and no details on coverage, so that makes it difficult to really assess it yet.